Hello, and welcome to Let's Talk Climate, a weekly webcast series from ecoAmerica, featuring dynamic discussions with local and national leaders offering diverse perspectives. Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, and I'm excited to welcome you to today's episode. Before we jump into our discussion, here are some brief housekeeping items. This session is being recorded and will be available for on-demand viewing on ecoAmerica's YouTube channel. Please engage with us online using the hashtag Let's Talk Climate throughout our discussion and in the days to come. And please use the chat function to ask questions throughout the webcast. You can send your questions to us by choosing all panelists from the drop-down in the chat box. ecoAmerica staff are standing by to answer any tech questions and help facilitate Q&A with all of you. All right, let's get started. On today's Let's Talk Climate episode, we'll cover A Vote for Health is a Vote for Climate with our fantastic guests. Dr. Linda Rudolph, Senior Advisor on Climate, Health, and Equity at the Public Health Institute. Hi, Linda.
Hi.
And Dr. Adrienne Hollis, Senior Climate Justice and Health Scientist at the Union of Concerned Scientists. Welcome, Adrienne.
Thank you. Happy to be here.
Thanks so much for being here. So first, we recognize that we're living during a syndemic. This is a term that's come up actually a couple times on this webcast, a time when multiple crises and exposures overlap to cause further harm. We hold our first responders and frontline workers, including community elders and youth leaders, in our hearts throughout this conversation. And with that context, Linda, you're in California, in the Bay Area, just wanting to ask, how are you and how's the air quality there today? Linda might have frozen. So Adrienne, why don't we start with you? I know actually my question for you is, I know your mom is in Mobile, Alabama, where Hurricane Sally just made a slow and destructive path. So I want to ask you, how's your mom and how are you handling and processing this climate disaster?
Yeah, thank you, Rebecca. My mom is good. We spoke before the hurricane hit. Of course, it took forever, right? Because it was moving so slow. And as with most people who are familiar with hurricanes along the Gulf, they have their emergency preparedness kit at home that they could put together. And so I went through that with her, like she used to do with me when I was younger.
Mm-hmm.
Did you put water in the tub? And people are always, why is there water in the tub? You need to flush the toilet, and all of those questions, flashlights, not candles. And my mom didn't lose power. She's by herself. She didn't lose electricity. But my brother, who lives in a different part of Mobile, did. But it was restored last night. So, and I have other family members who are still without power, but lives were not lost, at least for my family. So that's good, and this storm is, it's the concern, of course, with, you mentioned the syndemic, is that Mobile is a hotspot for COVID-19.
Mm-hmm.
And I think that's one of the reasons my mom decided she was not going to evacuate. And I'm sure other people did too, for the same reasons.
Mm-hmm.
Because of concern around whether facilities were, shelters were, I guess, COVID safe. So, yeah.
Did they have any specific messaging about that for people who might have been concerned about the dual crises?
If they did, my mom didn't mention it to me.
Mm-hmm.
She didn't have any information, but that's not unusual. There's that's another conversation about the lack of information or disinformation that abounded in Mobile these past few months. So.
Yeah, and maybe we'll get to that in just a little bit, particularly as it pertains to people getting to the voting booth as well. Linda, welcome back. Hi.
I don't worry about that. I don't know what happened.
It's the times we live in. So welcome, and Adrienne was just telling us about her mom, who's thankfully okay in Mobile, and I also wanted to ask you how you're doing in the Bay Area in California.
Thanks. It's been a pretty rough couple of weeks, but the air quality in the Bay Area itself seems to be better, although there's still parts of California with really horrible air quality. But we here, along with folks in Portland and Seattle, had, you know, the worst air quality in the world for days on end. And I feel fortunate that, you know, we are able to have the resources to have a HEPA filter in one room, and you know, we don't have asthma or heart disease, but so many people were just, you know, their health is really adversely impacted by these prolonged smoke events. And now I understand that the smoke is drifting across the country to impact people like you that live on the East Coast. So these smoke plumes can go for like 1,000 miles and create really hazardous levels of air quality. And it's something that is going to happen more and more frequently for more and more prolonged periods of time because of what we've done to our climate.
Yeah, and you know, September, so as a reminder, folks, we're in September. I know it's hard to keep track of time these days, but it's Preparedness Month. And so I know a lot of our public health partners, you know, at, you know, National Environmental Health Association, the National Association of City County Health Officials are putting out information about people to be prepared for these types of disasters, which are happening more frequently and more severely. And you both mentioned like HEPA filters, filling your bathtub with water. And I just, you know, want to remind our audience that it's really important to pay attention to local impacts and ways to be prepared to protect your health in the face of our changing climate. So thank you both for telling your stories and humanizing the issue in ways, because we still so often still talk about climate change is something happening far away and far from now. And so just really appreciate you taking the time to tell your stories today. And so for the next question, I did want to pivot a little bit into some of the polling. You know, in the description of this episode, we mentioned polling from Gallup and Pew that found climate change was second only to healthcare for Democrats, and that people across parties think climate change should be a higher priority for Congress. It is also worth noting that COVID-19 does not seem to have changed these attitudes. So I wanted to get your initial reaction on where you think we are on climate change as an election issue 6 weeks out. So Linda, why don't we start with you?
Well, I think we've heard more about climate change because just in the last week, because some of the candidates are making the connection between climate change and wildfires, or climate change and the increasing frequency and severity of hurricanes. And that's a good thing because that's consistent with what the science shows. But it's really incumbent on all of us to keep up the drumbeat of making sure that our neighbors, our colleagues, our patients, you know, get it, that not only are these extreme events, you know, extreme heat, which we've also had, you know, in the last month, are related to climate change, and that the only, you know, there's already enough climate change baked into the system that we're going to keep having worse wildfires and worse hurricanes and worse heat waves, but we can prevent even more catastrophic climate chaos by taking action now. And I think it's incumbent on us all to remind people that the most important thing we can do at this point in time is vote for leaders who care about our health and care about the climate.
Thanks. Adrienne?
Well, actually, Linda said it all. I totally agree. When I read the report, I was initially disheartened, and then I saw that it was earlier this year. And so I went back and did a little research, and you know, and I saw the Pew report from August, and it seemed like climate change dropped actually, and that healthcare was number 2, right? But the things that the people are concerned about, just as Linda said, I think relate to climate change. So I'm okay with that. If the title itself, I just think that people need to recognize the relationship, you know, that everything is interrelated. But so when people are talking about things that sort of like came to the forefront because of the pandemic, right? Because of COVID-19. Well, you know, those are things that are exacerbated by climate change, right? And so it's all connected. So my initial reaction was surprise and shock. And then I said, oh, but I'm sure everything has changed now that, you know, the wildfires and the flooding and the hurricanes and all of those things. And I was interested and a little surprised at the results, which I'm sure we're going to talk more about how divided the results or the responses are, so across party lines. So.
Yeah, I think it's so important that you already started talking about people realizing issues are connected, because that's my next question is really about, you know, when you do this polling and you ask people about healthcare separately from climate change, you know, it really only helps to solidify in people's minds these issues as separate issues. And you've already started to touch on this, but what are some things you're doing? What are some things you can recommend to our listeners to do to help people make those connections, particularly on climate and health?
Well, one of the things, I'm sorry, did you?
Yeah, Adrienne, go ahead. Yeah.
Is like if I tell, when I talk about, I'm gonna give you a perfect example, and I used it yesterday, the Hurricane Laura, and how it, you know, decimated parts of Louisiana and other parts, and at the same time was played a role in the biolab fire around Lake Charles. And so here we have two incidents, right, that are connected. And then the biolab fire continued to burn for 3 days after the hurricane. And then you had, don't forget, this is a high area that already has environmental issues, environmental contamination issues, Cancer Alley, environmental justice, all of those issues. But it's also a hotbed for COVID-19. And then when you had the fire, people were told, stay inside, close your doors, close your windows, don't turn on your air conditioning. Okay, if you're inside, for example, at a shelter that wasn't really designed for long-term stay, and you're with people that you had not been sheltering with, then now you have this issue of COVID-19, potential exposure to COVID-19 on top of chlorine gas, on top of the other emissions that were already occurring that even are increased when a facility shuts down, as a lot of them did right before the hurricane. You know, so once you, as you just said, once you personalize an issue, people remember it and they can talk about it from their perspective. And that's what's important, because then they'll tell their story to another person who can think about how it affects them, because people want to know three things. What is it? How does it affect me? And what can I do about it, right? And so those are the answers that I'm always trying to focus on telling. So.
Yeah, Linda?
Yeah, I think what Adrienne said is really true. And I think, you know, we are at a very pivotal point in terms of the future of our climate trajectory. Many people, myself included, really do believe that this is the most important election in the history of the world in terms of where we're going with climate change. So I think it's incumbent on everyone who cares about the issue to be talking about it, to be reminding people that this is an important election and that every vote counts, that it's really important that they get out and vote, and working to increase people's consciousness about the relationships between these issues and environmental injustice and health inequities, and you know, remind people that it's not what every individual does is important, but what's going to make a difference for our COVID-19 response, what's going to make a difference for our climate response, what's going to make a difference for how well prepared we are for climate-related disasters that are already in the pipeline, what's going to make a difference for addressing the healthy environment, the environments in which people live and work and play so that they have opportunities for health. Those all depend on policies and programs that we do collectively as a society. So who we elect, the kinds of leaders we put in place, the extent to which we demand that they listen to people who are impacted by all of these simultaneous cascading challenges really matters. And providing them with information about how to vote, how to get their mail-in ballot, and directing them to resources that allow them to explore these issues, as well as talking, as Adrienne, importantly pointed out, about the personal stories. So we can talk more, I think, about some of the activities that are going on now that will allow people to engage.
And I just wanted to add something too. Linda, you said it so perfectly. And I always try to emphasize that, climate change and our health, it's not a Republican, Democrat, independent thing, right? It's a people thing. And we need to be thinking about, we need to listen to what people are saying and ask ourselves the question, who is going to protect us, our children, the individual, those of us who are ill, those of us who are older, all of us. And that's the only thing we need to be concerned about. We don't need to I need to do this because I'm a Democrat or Republican, whatever. It's really about what's best for us to save ourselves and save each other. And all of the things you said, it was so, what you said, I just felt like I want to underline it, and just with that say, and stop thinking about red or blue or whatever, and think about green, think about people and lives. To me, green represents being, alive, and that's the color we need to be focused on, so.
I usually
Sorry, I just had to say that.
I usually want to underline everything you both say. So, I so appreciate, already connecting the dots. I think for folks who are immersed in climate science and overlap with public health, the connections are so clear. Then it's so important for us too to go out and talk about it. During our American Climate Leadership Summit, during our health panel, it was all about making climate change a kitchen table issue, so that people feel comfortable talking about it with family. Thanksgiving is coming up. Hopefully people still have an opportunity to have family time and can have those fun kitchen table conversations, those fun Thanksgiving conversations. So talk about it. I can't agree more, and I can't emphasize it more. So we started touching on the election, and the executive director of the Environmental Voter Project also participated in our summit last month. And one message they sent recently via email, I got one of their email mailers, and it said, the election is not on November 3rd, rather the election ends November 3rd. So how are we working on the election now to make climate and health a voting issue? And Linda, I think you had some specific resources to mention.
Yeah, so the Medical Society Consortium on Climate and Health, ecoAmerica, Healthcare Without Harm, PSR, APHA, a lot of groups are working together in a very ad hoc coalition to try and get the word out. So one of the things that we did was we developed a letter to Congress about the importance of allowing every American to vote healthily by expanding access to mail ballots so that people don't have to make a choice between voting and health during this time of the COVID-19 pandemic. I think it's important for people to support efforts to allow universal mail-in ballots. And you can find that letter to Congress on the climatehelpaction.org website. We also have launched an initiative to make very short, for health professionals, to make very short videos telling a personal story, personalizing this connection between climate and health, and emphasizing why, because of this connection, it's so important to vote for leaders that care about climate and care about health. And I think that's going to be, I think somebody will put that in the website, but we really encourage you, if you're a health professional, go to the website for Health Voices for Climate Action and sign up, make a 1-minute video. We can help you, especially if you're in one of our priority states. It's also really important that people participate in opportunities to talk to candidates. And you will also find on the Climate Health Action website resources for voters, or on the Medical Society Consortium website, we have a dozen questions that every candidate should answer about climate and health. Use those, not just for talking about candidates, but for talking to colleagues and friends and neighbors, so that people start thinking about what are the important issues we want to know about, what our candidates are saying as we make decisions about voting. And you'll also find at that same website an open letter to candidates explaining why they should be making this connection. So,
can I just, and just really quick to add to that, you know, ecoAmerica is a 501c3 organization asking, so, you know, very clearly we cannot endorse candidates, but asking candidates questions during a forum, as long as you ask them to all the candidates equally, that's a very 501c3 activity, right?
yes, 501c3s are absolutely allowed to ask questions. You're allowed to share information as long as you share it with all of the candidates in a particular race. And you're allowed to participate in get out the vote activities to encourage people to vote and to help them find the resources that they need to get their votes in.
Great. And I would also say that if you do work at a 501c3, but you very specifically segment your personal time as a you know, as a voter, as a person who is employing then the elected official, you can do whatever you want. So I would encourage individuals, particularly you know, speak on as a health professional, speak as an individual, as a resident. We heard one of our guests, who's an elected official from Baltimore City, say legislators want to hear from their constituents. They want to know what is important to you. So don't forget you employ them. Adrienne, other comments?
Well, I was just going to say that, you know, most of my work is mostly with communities, environmental justice communities. And, you know, we do our best. We have a project at UCS where we work in partnership with a number of communities, and we're trying to hopefully increase that number. But one of the things is, because sadly enough, there aren't that many states right now, hopefully this will change, that allow mail-in voting. And I mean, aside from absentee voting, you know, which is absolutely insane to me. I know Maryland does, you know, everybody automatically gets, you know, we're getting our ballot, but, you know, we try to work with them to support them as they help them plan activities such as, like, they know that they're going to have to go vote. So how can we do that safely? They provide transportation, they provide, you know, make sure that everyone has masks and gloves and things like that. And then even when recognizing that a number of polling places have shut down, which I'm sure we'll talk about later, they know that they're going to be in long lines. So what do we need to do for, you know, to help people maintain a certain comfort level? You know, provide chairs, we provide water and food and things like that. And so, you know, we've asked to, you know, how can we support them in that? And I've seen a lot of our EJ communities are really active when it comes to candidates. And I remember, if you remember before the conventions, that there was a forum at an HBCU where a lot of the community members were the ones who were asking questions. It was led by Mustafa Ali. And I don't recall that there has ever been one before. And one of the messages I know he was pushing, and we were pushing behind him, was that if a candidate isn't talking about climate change or environmental justice or healthcare, whatever, you need to think seriously about whether that's someone, you know, you want to vote for. As I said earlier, about voting for what's going to make you safe and help you stay healthy. So we see a lot of that, and we're working with our community groups. I've reached out to a few, and they're going to be providing a video also through a different EJ organization, a short video showing what, for example, Hilton Kelly in Port Arthur, Texas, showing the devastation from Hurricane Yeah, I think that was Laura. So many, so quickly, which is unusual. And how that impacts health, because of course they're located near a facility that in previous years, I think it was Harvey, had flooded, releasing chemicals into the flood waters, which then got into the groundwater. And if you were on well water, like that. So those short stories that are so impactful and so important, because that needs to be a part of any narrative that, anybody who's, trying to represent, the constituency, which is the people, that they understand that and that's their priority too. So, yeah, so, I think that the EJ communities and other communities, just the public in general, has been more active in seeking answers to questions. And I love that. And I think part of that is like when we see the protests around environmental inequities, and that's going to be a big part of elections also, as well as healthcare. And we saw that with everything that the COVID-19 has brought, to the forefront, like access to healthcare, quality of healthcare, things like that are things that people are looking to hear about, to hear candidates talk about, right? So I could go on. I'm trying to stay calm.
Yeah. Well, I don't know if now is the time for calm, to be honest. But I think that what you've talked about after Harvey is really important to talk about, because it's that syndemic. Before there was COVID-19, there are other diseases that people, have as underlying causes. Linda mentioned, underlying diseases like asthma and heart disease that can make you more susceptible to COVID, and especially if you're exposed to further air pollution. This was going on before COVID-19, and in a way, COVID-19 has really shed a really harsh light on the health disparities and economic disparities in the country that tend to exacerbate, bad things when they happen. But this was going on already, and we really, when we work on economic equity and when we work on dismantling systemic racism, we achieve better health outcomes for all. And so I think those were really important points to make, and relevant to voting, if you ask me. But
they are relevant, but I just want to chime in here, because I think it's really important that the flip side of talking about all of the challenges that we're facing because of the climate crisis, is that we know that climate solutions are good for health. So, when we stop burning fossil fuels for electricity and fuel in our cars, we also reduce air pollution. And we know that communities of color and low-income communities are disproportionately exposed to air pollution from busy roadways and to air pollution from petrochemical facilities and refineries. So when we reduce that air pollution, we're not only improving health for everyone in our communities, but we're also starting to address those health inequities. The same thing with, creating healthier food systems. We know that low-income communities are disproportionately impacted by the lack of access to healthy and affordable food. So, we know that, children, Latino children have higher rates of diabetes, largely related to lack of access to healthy and affordable food. So these climate solutions that we're looking for to forestall the worst climate change also improve health in our communities and start to redress some of the health inequities that also make people more vulnerable to the health impacts of climate change.
Yeah, and I have to say that it's so true. The research that has been coming out slowly but surely around the possible connection between air pollution and COVID-19, right? The particulate matter may be a carrier for the virus. And so if you're already in an area that has a high level of particulate matter, and you also happen to be in an, that is another way that you may be more susceptible to getting COVID-19, right? That's one way. And, we've seen studies from Italy, from China, from actually here in the US, the Harvard study came out about PM 2.5, particularly matter 2.5. So, that's an issue. And we need to just think about these connections. And I'm going to go back to the protests and the use of tear gas. And we know that tear gas affects the lung, the respiratory system. And it begs the question, if you know that happens and you look at who's marching, was that on purpose? You know what I mean? Like, are you making people more susceptible on purpose, or are you doing it without even thinking about the ramifications of the actions? Because everywhere else, tear gas is pretty much banned. And here, I think it was banned except for use to control the population or something, some language similar to that. And so here we are full circle again, talking about how all of these different activities and decisions we make are connected, right? Because we see this, it's not just COVID in the community and you have these existing conditions, but also you have these particular pathways or opportunistic pathways that may increase your risk too. So we just need to think about all of that, and those are that's personal. That's how you can make an issue personal.
And thanks to ecoAmerica staff, Jess is putting in relevant articles to back up everything you guys are saying. So thanks to Jess for being super on top of it, and Mark, for running the show behind the scenes. It takes a village here to put on the Let's Talk Climate broadcast. And I, it's also true that thankfully COVID-19 is not a disease that affects children disproportionately in ways that other diseases do, particularly environmental exposures. But for the kids, for the kids that are getting it, they're kids living near fossil fuel polluting facilities, because those are the facilities that harm lungs, that impair development, cognitive development, as well as heart and lung development. So, it is a disease that we're seeing in particular disproportionate burden on Black and brown children, where it's a disease that otherwise, thankfully, and we don't know all the reasons yet, but isn't affecting kids as much as older adults. So really important issues, and take them into the voting booth. And so we actually had a question. A couple of things have come in from our listeners. So first of all, give Leon a shout out because he's voting tomorrow. Next week. I'm voting next week. He said that Virginia is opening up tomorrow for advance voting at the registrar's office with plenty of safeguards in place, large space, distancing, few people, masking, etc. So we know, we've heard about Virginia, we heard Maryland, DC is also mailing ballots to everybody. Every registered voter is getting a ballot in the mail. And I got a little notice from the Postal Service saying, if you're planning to vote by mail, do it early. I got a notice specifically from the Postal Service telling me to do that. And then another audience question from Marcy, who actually submitted this as part of their registration. What are the key nonpartisan messages we can share as organizations to get out the vote? And either one of you can start.
I think we kind of talked a little bit about that, just a little bit, about the fact that we have to think of it, not in terms of Republican or Democrat, but in terms of people and protecting people. I mean, I think we're about to, or did we just hit 200,000 deaths from COVID-19? And I'm not sure. I think we're closer. We may have already hit it today. I'm not sure. But nobody's asking how many were Republicans and how many were Democrats, right? Because that's not really important. The issue is that people are dying and people are infected. I think in the US it's over 6 million people or whatever. And so what we need to do is help people see beyond, I know in the past there were people who would vote the Democratic ticket because they're Democrat, or the same for Republican. And now it's about voting for things that, now none of that should matter. It really shouldn't. When I looked at some of the poll results, I saw that for Republicans, that economy was number one. And this was in the most recent Pew study. And I'm thinking that's great, because economic oppression is a big issue. And with the separate from that, we have the economic repression that happened as a result of COVID-19, right? A lot of the small businesses were closed. A lot of my brother is a frontline worker, and a lot of frontline workers, both two brothers. So one lost, they were laid off, and the other one had to work continuously. And at first, there was this whole issue around masks. So we need to just, the way to, I think, to get the message out is to, and I'll keep saying it, is to personalize the issue, because it is personal to everybody, right? And we've got to get beyond, at this place, in this time, in this moment, we've got to move beyond party affiliation and move towards people affiliation, right? So
I think the question about how to be nonpartisan in getting people to vote, 501c3s are explicitly allowed to engage in get out the vote efforts, and on a more individual level, I think it's important to keep reiterating to everyone we know, to patients, colleagues, friends, neighbors, that voting is one of the most fundamental rights, and it's a fundamental responsibility in a democracy. It is the primary way that every person in a society, except the many people, unfortunately, we have in our society right now who are disenfranchised for one reason or another. But everyone who can vote has a responsibility to vote, because that's the way that we choose the leaders that will make decisions that impact all of our lives. When we vote, whether it's at the local level or for school board or for the president or for the Congress, we are choosing who will make important decisions that impact each of us and our families and our kids and grandchildren and future generations. And that's just never been more true than today, when we're confronting these, as you called it, a syndemic, Rebecca, these simultaneous challenges of a COVID pandemic to which we have not seen an adequate response, climate change, where we have a very narrow window of opportunity to implement the policy and programs that are needed to change our greenhouse gas emissions trajectory, and economic and racial injustice that is really harming the health of millions of people of Black and brown people and people that are living in poverty. So if we don't make the choice to go and vote, we are abdicating our responsibility to put our thumbprint on which direction we want our country, and more importantly, the lives of ourselves and those around us, to go, facing these multiple challenges. We can say all that without saying anything about who we're going to vote for, and just encourage people to vote for whom they think is the right person to vote for.
Yeah, I remember for when I was growing up, election day was a school, they use the schools for polling places. So we were off of school. And my grandmother, so I'd go over to grandma's house and she would take me voting. I remember, and I was young enough that I think at a certain age, they stopped letting you go in the voting booth with somebody. But I remember she took me into the voting booth with her. She pulled all the levers and I got to pull the big red one. And so she instilled in me in a very young age how important it was and how fun it was, and making it a family affair. I honestly haven't thought about that a lot. This conversation is making me think about that, and also miss my grandma. But she instilled those values in me, right? And I got to go vote with her, and that was something I looked forward to. And so I wanted to share that story for others who are, who can make this a voting a family affair. and talk about it at the kitchen table. So we've talked a lot about, you know, the COVID-19 crisis, like the climate crisis, impacting Black and Brown communities first and worst. These are also places, Black and Brown communities are also where there's an active effort to suppress votes. And I think, Adrienne, you already mentioned some mis and disinformation campaigns, and these are targeted campaigns. How are we supporting communities facing multiple threats as they work to have their voices heard on election day? And Adrienne, why don't you go first?
Well, you know, one of the important ways that I see us, one of the important roles is education. And I'm going to give you just an example on a micro scale. And I'm going to go back to Mobile, which is a hotspot. So my mom, who is immunocompromised, 4-time cancer survivor, was apparently there's this information going around the city that you have to have this new ID, right? The real ID in order to vote. And so I went on, you know, I got the information. I said, you don't have to have it. You don't have to have this. But they had been told that you have to have it to vote. So people are paranoid about going out. So you're exposing yourself to COVID. You're going out, you're getting this license. And it's so frustrating that this is happening. And when, you know, she was going to come up here to visit with me. And part of it is, you know, Alabama doesn't do mail-in voting, but you can get an absentee ballot. But to do that, you have to apply for an application for an absentee ballot. So I was telling her, well, we can apply to have your application for the absentee ballot sent here. And she goes, well, then, will I get it? Will I be able to say, no, then we have to actually apply. And all of those steps are ways to confuse people and suppress people's ability to vote, because you may think that when you apply for the application, you've applied for, you know, for the ballot, and you haven't. You've just applied to apply for the ballot. And so just educating people and even using social media and getting the word out, those are different things that, you know, that we do, and just encouraging our community organizations to direct people to trusted sources of information, instead of just, oh, I heard this, I heard that. You know, go to the source. And because I spoke with the person at the federal building, but I don't know where my mom was getting that information from. You know, so just working to, you know, when we hear about these things, one of the things that when we hear about these rumors and misinformation, it's incumbent on us to jump on that and sort of like be a screen and say, well, no, this is the trusted source, or this is what I heard. So education is one of the key ways, as well as ensuring, as I said before, in opportunities in places where people don't have the opportunity to vote what I consider to be safely, to me, that's of course not having to go somewhere and vote. But the next thing, of course, is to make sure that as they vote in person, that they are doing that in a safe manner, you know, and I, you know, it's just, people aren't told things. And so I feel like, you know, it's incumbent upon us as scientists, as health educators, as health professionals, to get that information out to people.
Yeah, Linda, did you have additional thoughts on combating voter suppression?
Only that there are organizations that are actively working to protect the right of every American to vote, and we should be supporting those organizations.
Yep. And so, Adrienne, you mentioned trusted sources, and we had an audience question from Aaron, who says, how can we bridge the divide? And I think we've talked a lot about bridging the divide on you know, getting out the vote, and on climate solutions. But she's really asking what can be done about people who don't trust science. And I know there's been a lot of attacks on science over the last couple of months and days. And so just wanting to get your thoughts on what can we do for folks who are showing maybe a miss or distrust in science as a field.
Gosh, that's a hard question, and I'm hoping that Linda has an answer. But one of the things is, that I know we've been taking the opportunity to, at the Union of Concerned Scientists, which has been under fire, of course, as most organizations have, is to shine a light on what's happening. Like, I saw a tweet string, a tweet string that dealt with the fires in California, and it was, "Do you believe in climate change now?" And just provide that underlying information as to one of the reasons why this is occurring, or the fact that, putting an educational spin on things, like the fact that we're running out of names for hurricanes, and this has only happened once in the history of hurricanes, and it was, years ago. And one of the reasons is because we have so many at such a, so early in the season, we're having so many back to back, and so taking advantage of every opportunity to explain things in a way that people, can relate to. And also, we do a lot of partnering with our scientific partners. One of the projects that I mentioned earlier that I'm working on, it has both a public health component and a community component. And the reason for that is so, usually your most trusted sources of information are your churches and your doctors and nurses. And so that's why it's so important, the work that Linda and others are doing, and that UCS is a associate partner with, to figure out different ways to interact with the communities and to get the information out there. And if your trusted source, if you don't trust science, then maybe you'll trust your priest, your pastor, your church member, or maybe you'll trust your doctor or your nurse practitioner, or a healthcare provider. So what we need to do, what we have been doing, and what we are seeing more of, and we still need more of, is that partnership, right? So
I don't have anything to add. Adrienne said it all. And also just, I want to call out UCS, Union of Concerned Scientists, for really being on the forefront of defending science and its importance. It is somewhat ironic to me that our federal administration is now putting so much faith in science to develop a vaccine to help us deal with COVID. And I hope we can figure out a way to pivot from the importance of science in developing a COVID vaccine to the importance of other vaccines and the importance of science in confronting other issues such as climate change.
Right. Yeah, totally agree.
Yeah, ironies abound in this administration. So, and I have to give a shout out to our sister program at ecoAmerica, Blessed Tomorrow. So we work in the Climate for Health program with health professionals, but we also have a faith program for the exact reasons that Adrienne mentioned, and that we're working more now and into next year about doing more intentional cross-sector collaboration, and that's been a really exciting area to explore here at ecoAmerica. So we're approaching the end of our time together today, but I did want to ask, let me just double check and see. No, I know that there's been a few more audience questions. One is, very, very briefly, could anyone comment on any business sector, anyone in the business sector that's actually working to combat climate change? Just really brief, if you know of any good examples.
There's a lot of activity going on in the business sector to combat climate change. Within healthcare, there's a lot of people in healthcare systems and hospitals that are working actively to build more resilient health systems and to reduce greenhouse gas emissions in the healthcare industry. Ceres is a business organization that's working with businesses across many sectors to address climate change. So I also just want to, point out, it's not quite the answer to the question from the audience, but the fossil fuel industry continues to pour millions of dollars into hampering and impeding progress on climate change.
Mm-hmm. Mm-hmm. And for, I would also say there's tons of small businesses too. I think the business sector, but I think you see more and more small businesses working, you know, they have a smaller footprint to start. And then I think there's maybe more of an opportunity to take on more sustainability initiatives. And I also, we called out at our summit, Microsoft, for being one of the first businesses to talk about not just going carbon neutral, but actually removing historical carbon emissions, which when we talk about climate ambition, ambitious climate solutions, that's where we need to be going, not just eliminating our current carbon footprint, but starting to make amends for previous emissions, to take carbon out of the atmosphere. And so I encourage folks to go to the ACLS playlist on the ecoAmerica YouTube channel to check out some of those discussions that we had during our summit. And yeah, go ahead.
Rebecca, that's another really important sector. We don't usually think of it as being a business, but farmers and ranchers who are working to build healthy soils and increase the investment in regenerative and agriculture, they're working to combat the climate crisis. And of course, there's a renewable energy business sector that's contributing by helping us move the transition to clean energy. So the business sector certainly isn't monolithic, and I appreciate the caller, the questioner pointing out how important it can be.
And then there was one last question about the Postal Service, because I know I briefly mentioned it, but saying there's been a lot of news about the attacks on the Postal Service, but that there's not. Have folks heard from their local postmaster about being able to deliver timely mail? And all I can say is that I did actually get, my mailer came from the U.S. Postal Service saying, if you are going to vote by mail, do it early to make sure there is time for your ballot to get in. So my warning came directly from the Postal Service, although that's not, I guess, the same as your local postmaster. But any other quick comments on that before we go to the last question?
Yeah, just put in the chat a link to an article that was just in the New York Times within the last couple of days that actually analyzed mail delivery and showed that it has gotten slower across the country since the appointment of Louis DeJoy as U.S. Postmaster. So I think there's some evidence that's been developed by the Times and others showing that mail delivery really has been slowed down. And that, considering that the U.S. Post Service enjoys probably the highest level of support of almost any agency, perhaps other than Social Security and Medicare, we should all be demanding of our elected officials that the integrity and efficiency of the post office be protected. It is a vital service for every person in the country.
Yep, very much agreed. And so I have been on the verge of asking so many additional questions today because all of your comments have, spurred new ideas and actions. But I want to wrap us up with one more question, lightning round question, one of my favorite parts of these webcasts. So 2020 is the year that lasted a decade and has brought new meaning to the expression, this is a marathon, not a sprint. And yet 2021 is staring us in the face. What is your one climate and health priority for the next 4 years? It's a simple question.
Adrienne, go for it.
Gosh, well, my number one priority is to not necessarily reinstate, because we want to improve the current regulations, and this is environmental protections that are in existence, to not only take the opportunity to reinstate them, but shore them up to ensure that we are protecting the public generally. And so put all of the over 100 pieces of legislation that have been rescinded, removed, whatever you want to call it, let's put them back better and start really focusing on what we need to do to protect people.
My number one priority is to make sure that we elect leaders that care about our climate and our health, and that will enable doing what Adrienne said, but also that will lead us in the next 4 years to doing the many, many things that have to be done with great urgency to avert further climate catastrophe.
Brilliant. Thank you both. Thank you so much, Adrienne and Linda.
What's yours?
Oh, good question. So mine, I think, is I would like to see comprehensive cumulative impact legislation passed on a federal level, so that then states can go further, as many would like to do, but keep using the excuse of not having a federal roadmap for that. And so much of what we have talked about in terms of climate solutions and a syndemic can be addressed through having a way to look at these issues, in a way that's comprehensive and connecting folks. And we just need to break out of silos, because the more, I just think we've come to a place, whether it's party or legislation, there's just so many silos, and I feel like cumulative impact legislation is going to be a way to break down those silos, and help get some of the solutions that environmental justice communities have been asking for decades. And so that would be, I think, a way to get, although, I also, with my ecoAmerica hat on, I think we should really get some of the, really remove carbon from the atmosphere. So I've got to put that in there too. But so maybe more than one priority. So I just want to thank both of you. Thanks, Adrienne, for that pop quiz at the end there for me, keeping me on my toes. And just thank you both for joining us as our guests today. We are grateful for the words you shared and the work that you do. We're at the end of our time, but I know you have inspired our listeners and our future viewers to bring their climate and health values to the voting booth and into the next 4 years. Join us again next week on Thursday, September 24th for the next episode of Let's Talk Climate, Faith and Climate in the Voting Booth, when our Blessed Tomorrow director will be in discussion with Brian McLaren, American pastor, author, and activist, and Jackie DuPont Walker, director of the Social Action Commission with the African Methodist Episcopal Church. Please click on the link to the survey when this webcast ends to provide your feedback. If you're watching this on YouTube, check out the description below to let us know what you think. Engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, get out the vote, and see you next week.